So this is the idea behind health hubs. And yeah, I've used ChatGPT again because clearly this is fake. You have to be careful what we see on YouTube. So these are the problems. This might be a familiar picture, but yeah, this is about dental screening, which is slightly different to dental treatment. What we can do is we can fill up white space and we can use these hubs. Personally, I don't have the evidence, but I know someone who probably has. And if we use a bit of alchemy, then it certainly works. So this is where we were, and this was my idea a while back to think about the vouchers. And the ICBs have brought this in now, which I think might be a great help. The latest initiative will allow dental nurses to become empowered to carry out further duties, which in the main will be about screening using the digital devices that keep coming down in price and keep improving in their efficiency and assessment. Soon we'll be able to use all these different data points to actually give a report that's meaningful to the public. We just need to train the team now so that they're ready when it all becomes available. So this is a great example of what we can do using modern technology. So this isn't a fake picture, but I never went there. But if you look at Timpsons, they've diversified over the years and do a couple of different things. We can do the same in a dental practice. So Timpsons share photo data. Well, we could do the same for scanning. What's the difference? We just don't have a face on it. And if people are happy to share their data and we use machine learning, then the assessment tools will improve year on year to everyone's benefit, the old win-win scenario. Within dentistry, we have other entrepreneurs who've actually tried to do the right thing and to engage their clients to take back control of their general health as well. Similarly, we have people helping support the vulnerable with both online and face-to-face training. For preschool advice, we could learn from this group. We're engaging the children in a manner that they like rather than what we think they'd like. And this independent group who provide care for those that can't access dentists. They all have one thing in common. It's set up because of this. They had a vision to help these particular niches, along with an inspiring leader in our committee. We're able to make the decisions for everyone's benefit. They have had the experience in setting these things up from which we could all benefit, as from their hands-on experience they have the knowledge, and from their vision we clearly want to share it. And they are not alone. Even though we work in the health business, we can learn from other businesses who are keen to share their experience and what worked for them and what didn't. We have a very flat structure with a single leader who empowers the staff and lets them get on with it. That's what we should have, and it involves this, which the whole dental team need, and especially our patients. Suitably trained staff, we could have health hubs with scanners and x-ray units and treatment coordinators with the digital skills to upload everything onto the computer, then get the assessment, and along with discussion with the user, an estimate from a dental practice for treatment, or just further follow-up prevention advice through teledentistry. On the other hand, there is a shortage of dentists and hygienists, but all these dental diagnostic tools are idle and could be used by a dental nurse there. So simply just do the assessment, go through the coordinator, and the same process. It doesn't necessarily mean that you have the treatment in the same place where you had the examination. You just need to set up teledentistry as I've promoted here. It's not on the list for apprenticeships, but it should be. And while we could pick holes in the pathway that they've started, I'm sure you can pick holes with what I've said, but we need to have that discussion. We need to collaborate and integrate our services. Training nurses on the job as opposed to at a desk has always been the best way. On the other hand, I think this is just pie in the sky. It'll never happen. Resources for dentistry will be attributed elsewhere, as has happened before. We need a bit of alchemy. Since retiring, I've been on a lot of different courses, but the one on health innovation in Southampton was enlightening in that While I was able to get on it, it was clear there's no funding for dentistry, but there was funding for obesity, and there's also funding for cancer screening. And clearly these are both linked to dentistry and the services that we provide. I spent a further few days applying for mouth cancer screening, but I didn't get anywhere. I think they saw dentistry in the application. What was interesting was this. Mouth cancer is skin cancer, and this device sits on a phone. And like when I went to get my cancer check, I never saw the dermatologist, I just saw the photographer. In a similar vein, I've just given blood. And what was interesting, the phlebotomist had all his 6 weeks training. Education system hasn't changed in years. And only 10% of the therapists who have further education carry out therapy work. They get more money and it's less stressful working as a hygienist. This was bad news for the health company. It was far worse for the people they were meant to serve. They say they ran out of dentists. They didn't run out of premises. They could have used their equipment differently and had a business based around prevention rather than just purely profit. I had a problem with white space myself, and that was caused by the NHS moving the goalposts. And please have a look at this letter. It's a plug for teledentistry. It should be part of the apprenticeship programs, and it should be open for dentists as well as nurses. We could all benefit from improving our IT skills.